I did my due diligence to find out, is this something for me? Awesome. And I suggest everyone, even second, third generation dentists, kids, whatever, answer that for themselves. Find out if you really love it, because if you make that mistake of going into dentistry and not loving it, it's going to be pretty long 20, 30 year career,
right.
From the cubicle to the lab, the studio to the war room, climbing the corporate ladder, or joining a scrappy startup, experience a day in the life of the jobs you want. This is the Experience a Dental podcast.
We interview professionals, entrepreneurs, and recent grads to inspire you to gain experience beyond the classroom and launch a career of your own.
We're your hosts, Krista Bowe
and Matt Poe.
Do you love working with your hands? Looking for a career at the crossroad of art and science? Maybe you're looking for an alternative to a traditional med school path. In this experience episode of the Not Acci-Dental series with dentist Dr. Alex Vasserman, we're going to show you how Alex chose his career path based off his passion and stuck to it. What got you into dentistry in the first place?
Yeah, I know you said you come from a family of dentists.
Yes.
So.
Doctors, dentists. My grandfather was a pulmonary doctor, and my grandmother was one of the first surgeons in former USSR. My dad was an oral maxillofacial surgeon and a dentist. My brother's a dentist. My in-laws are dentists. So growing up, I was around medicine all the time. But then seeing the ability to work with your hands and also be that medical and think on your feet and have kind of different things throughout the day, I kind of went in that footstep. When you're exposed to it as a kid, you kind of, you're like second, third generation, right? It's like one of those traits. So cool. It's cool.
You mentioned you liked the aspect with dentistry that you work with your hands. Were there any other areas of interest that kind of, sparked your interest?
I was thinking,
was it always just dentistry?
No, I was thinking. So what I did in undergrad is I really thought about it, and I said, am I going to go into medicine, or am I going to go into dentistry? So I spend a lot of time trying to answer that question, and I worked as an orderly in the OR. I cleaned up operation rooms and I saw surgeries. I worked as a receptionist in a medical office, so to see what's the day-to-day life like, and I actually put myself there. I worked as an assistant in my family practice with my brother and my dad to see, and I thought dentistry was a lot of fun, and I did my due diligence to find out, is this something for me? And I suggest everyone, even second, third generation dentists, kids, whatever, answer that for themselves. Find out if you really love it, because if you make that mistake of going into dentistry and not loving it, it's going to be pretty long 20, 30 year career. Right. The thing here is you're dealing with no one wants to go see the dentist. Most people don't. Nowadays, you get the cosmetics, you get the whitening, but I would say 70% of my patients, if they had a choice, they don't want to go to your office, right? People want insurance. People want other things, so they go into, they go into your office kind of like, okay, I guess I need a mortgage, or I want a mortgage. No one wants that crown. No one wants to be. So that's where you want to be the hero a lot of the times, where you get to get someone out of pain, where you get to fix their broken tooth, where you get to say, this years of neglect, let me help you out. There's a lot of art in it, whereas unless you're doing like plastic surgery, those advanced TV shows, there's really not much of that in medicine.
Gotcha.
So I kind of like that art.
Okay.
Cool.
Awesome.
So, cool. And growing up, I was pretty artistic.
Okay.
I could draw and sculpt. So I applied that to my craft. Now in dentistry, I get to use digital design. I get to use models. I get to play with wax. So there's a lot of really cool stuff when it comes to that.
So fun.
Yeah, a lot of people just see, they see the dentist from their perspective, going into the office,
Right.
do the teeth clean or do the whole routine, but then
Right.
they don't see the other side of it, what you're doing. They don't see the dentist playing with the wax. They don't see the art side of it.
Right.
So that's really cool that you're bringing that up. I like
And
it.
and a lot of it is in the background. You're right. It's in the lab. It's when it's the after hours sitting in front of my MacBook,
Definitely.
doing the digital design, then translating that into wax, and then translating it into teeth, because there's so many different sizes and shapes to teeth, right? So it's you have to love it, right?
Yeah.
And
Right.
so I do, and I enjoy it.
I'm sure you can guess that getting into dental school isn't easy. To prepare, some start as early as high school, but Alex told us that if you're passionate about the subject and willing to work hard, you can really start preparing at any time.
You mentioned high school, your interest in high school, and I read an article titled How Dental School Works, and it said basically that preparation for dental school starts in high school. Do you agree with that?
Some of my classmates were in their 30s.
Gotcha.
They've tried a lot of different things. I don't think that you could, and a lot of my dental school friends and classmates were that second, third generation because they've been around dentistry all their lives. But I've seen, my buddy Corey, he was like a 30-year-old guy in dental school. He was in finance,
Right.
and then he went into dentistry. So there is certain truth to that, but you can go into dentistry at any age if you
Gotcha.
really like it and you're passionate about it.
Alex went to the University of Massachusetts at Amherst for his undergrad and double majored in biology and psychology. A key component to remember when picking a major to suit dental school is prerequisites.
There's different paths you can take. You have to, in order to get into dental school, you have to have a biology background, chemistry, physics. There's a track. Now, whether that's pre-med, pre-dental, or any other, I know psychology majors that just took their courses that they needed to get in. So as long as you have your prerequisites, biochem, physics, you can do anything. My major was biology and psychology at the same time. So I did both of those in case I wanted to broaden my horizon.
Definitely, yeah.
But, I know communication majors that took their prerequisites for dental school, took their DATs, which is the dental admission test, and then got in. So majors really don't matter as long as you have those courses
Okay.
to get into dental school.
Makes sense.
Sweet. And then I also read in that same article that they ask for 2 semesters of calc. Is that still a thing? And do you use calculus today, would you say?
I remove calculus.
Okay.
Calculus is build up tartar. So that's a dental joke.
Oh my God, that was amazing.
Sorry.
Please keep doing that.
No, the majority of the math that I do is very basic. Most of the math that I do has to do with running my books in terms of the business end.
Gotcha.
Really, there's not much math. I don't know why they make you do calculus. I remember I was always good at math. So for me, Calc 1 and Calc 2 was pretty basic. I really have no idea why they make you do that. I don't even know why they make you do a lot of the stuff that they do in
Yeah.
undergrad.
What are some other classes you think?
Well, like
are-
biochem, on a certain, degree, I wish that they taught you more business courses.
in the core curriculum? you think?
Communication, how to speak to people, how to actually listen to someone and be empathetic, right? But it is what it is,
Yeah.
right? And you just have to kind of deal with it. But the good thing about most undergrad places is that you could take those courses on your own.
Right.
And I would
You have
suggest...
some room to
And I would suggest
experiment.
you do.
Yeah.
No idea why I did psych. I
you like
mean, it was interesting. Do I apply psychology to my practice now? I mean, just listening to people, and giving them the ability to talk.
Okay.
That's it.
Cool.
Right.
Yeah.
I don't know why I did a lot of the things I did in college, right?
I think many people could probably say that looking back.
Great. So what did your resume look like in college and undergrad? You mentioned
I was a dental assistant in my family's practice. Very, very part-time. They had an assistant, but I would always shadow and hang out. So I know the dental business aspect pretty well, but I did all those jobs. I was a waiter, I was a dishwasher, I was a caddy.
Awesome.
I did landscaping, and the more jobs you do that in high school, the better. It's great. It taught me how to deal with, the tough blue collar guys that are I'm landscaping with, to knowing what it's like to do a really good job for my boss who expects all the dishes to be washed by a certain amount of time.
Right.
So. Yeah, that's my resume. I did all sorts of jobs.
Jobs like serving, caddying, landscaping can teach you invaluable skills like customer service, multitasking, communication, and how to listen to direction and take criticism well. All skills that'll put you to the test in job interviews, job applications, and day-to-day tasks on the job. But as Alex said earlier, you got to do your due diligence and get opportunities that will test your affinity to any industry.
After Alex graduated, he took 2 years off because his GPA just missed the cutoff to qualify for dental school right away. It worked out, though. He attended Boston University in Boston to get his master's in graduate medical science. Killing two birds with one stone, he was able to develop his medical knowledge while also boosting his grades to get into dental school.
I was very close to getting in right away, but I needed a little bit more. My dad passed away during undergrad, so my grades were not like the greatest. So I ended up taking my master's degree to take some post-grad courses to show the admission boards that I have the ability to basically get good grades in dental school.
Gotcha.
Did great, took those courses, worked as a bartender the whole time, worked as a bar back in certain places, took my undergrad. I actually also worked after undergrad in this is where my psychology degree actually helped. I worked in a neuroscience lab at Boston University, so I was able to take the post-grad classes at half the fee.
Oh, nice.
So that was kind of cool. So I had my 9-to-5 job, and then I would take the courses as well. Pulled up my grades, was like very close to like a 3.6, 3.7 GPA. And then in dental school, once I was in, the clinic portion, I think I was like top 20 in the school. Nice. Because I was able to use my hands, my medical ability, and et cetera. So
Great.
It's really cool. That gives for other people, that gives people hope, right? And going out, having bad grades in undergrad and thinking that like
multiple choice tests. I'm never secure enough in that. You look at it and then you look back on it, and you're so like longhand essays. I could always do well, but when you have 1 out of 5 and you can eliminate 2, and then it's always between those 2, and then you change it like 5 times.
Oh gosh, yeah.
It's no way to test someone, right?
Yeah, I agree.
So,
totally agree.
So those, and I was close. I mean, I left with like a 3.3, 3.4, something like that.
Which is,
it was fine,
not bad.
but it wasn't. You need to have a little bit of better marks to get. And my DETs were good. And the first interview, they were like, you're close. Just go take some courses, come back, and and I was a shoo-in at that point.
Cool. So
what are the interview processes like getting into dental school?
It's a conversation. They look at your resume. They look at your test scores. They look at who you are as a person, your experience with dentistry. It's a very lucrative field right now. It's very competitive. So yeah, it's, I had 2 interviews, and second time I got in.
Sweet.
Cool. So those 2 years that you took off, well, it wasn't taking off. Was that just a whole grind of working in classes and just nonstop working?
Yeah.
Awesome.
I worked 9 to 5 at BU. I barred back. and I took the courses.
That's awesome. Dedication right there.
Yeah.
That goes back to you gotta love it. Right?
And I was also in the band, so it was good.
Okay.
So it was good.
What'd you play?
Yeah, I was a drummer in a punk band. Yeah, it was great.
Awesome.
Yeah.
Do you have recordings?
I can dig them up.
Oh, we're gonna have to hear that.
Yeah.
That's awesome.
Great.
Yeah.
Gotta love and respect the hustle. Alex applied to dental schools in the Northeast, including Buffalo, UConn, and Boston University. But ultimately, he stayed put at Boston University with a nice transition from his master's to dental school.
What are important things to consider when you're shopping around for dental schools that you want to apply to?
Money. Some schools are as high as $60,000 to $70,000 a year. State schools like Stony Brook, UConn, are significantly cheaper, especially for in-state. So I would tell anyone, if you don't need to go into crazy debt, don't. Look at money first. Obviously, then you want to, if you want to be close to your family, stay close to your family. If you have, like I had connections at BU because I was working there and taking my post-grad classes there, so I knew the dental school, I knew the professors. Mm-hmm. That's why the second time I was interviewing, it was a little bit easier to get in.
Gotcha.
So, but where you go to school really depends on location and depends on money.
Gotcha. And then you said if you could just pick the schools that are cheaper, but is there, with like clout between different schools, like does that matter, the status of each school?
I guess when someone is looking at your diploma, maybe Columbia sounds a little bit better than Iowa, but at the end of the day, people are going to come see you as a person. People don't go to see what it says on the diploma.
Right. And people don't even ask that.
I've went to doctors and I don't look where they graduated from. I go because someone referred them to me or me to them, and because of their reputation. So if you're, if you're genuine and a good person, I don't think it really matters in the long run.
Depending on your career path, you could spend anywhere from 4 to 8 years in dental school. We'll get into the different types of careers in dentistry in the advice episode on Friday, but for now, here's generally how dental school works.
What kind of courses were you taking, and what was the degree pathway? So I read that the first 2 years are normally you spent in the classroom, and then the last
Mostly.
two. Yep. And then with each specialization, how many years? Like, does the years differentiate between what you choose, or is it a strict 4-year?
Great question. So when you get into dental school, the first 2 years, you're right, are generally spent in the classroom. You're learning things like physiology, anatomy. Second year, you balance that with mannequin training.
Okay.
So you get like these fake heads and you get to like practice on that, which is kind of cool. You get
cool.
to, so you're almost there, not really. Certain schools vary. So like I know on the West Coast, they get to see patients like second year. They get to like train on real humans. Not on set. Right. With us, our experience, it was third year. You get to start seeing patients very supervised, very like you get to first practice on your classmates a little bit. Right. Then you get to like, then once you finish your curriculum, you have in dental school what's called requirements. You're required to do X amounts of various procedures. So you need to do certain amounts of crowns, certain amounts of extractions, etc. Once you finish that curriculum, you graduate. You get to sign off. Then there's also board tests, etc. You take all those tests to get your curriculum checked off, or you get your requirements done, and then you graduate. Certain people apply to specialties during that fourth year.
Oh, okay.
Certain people can apply a little bit later on. My wife, for example, who we met in dental school, she finished her pre-doc. She was a general dentist. She did her general dentistry residency. She worked as a general dentist for a year. And now she went back to Columbia for her orthodontic training, which is a 3-year program at that school.
Okay.
So certain specialties you can apply down the road. Some dental students apply during that 4th year, and then they go right into their residency, which gives them the ability to be a specialist. Pediatric residencies, certain residencies at 2 years, others at 3. So you're looking at about a 2 to 3 year commitment after dental school to be a specialist. Gotcha. It's anywhere between 2 and 4. Oral surgeons, some of them could be up to 6 years.
Oh, wow.
That's a lot of schooling.
It's a lot.
A lot of training.
So you get your MD, DMD, which means you're both medical doctor and you can, do surgical stuff.
Now looking back on all the times I went to the dentist, I know exactly who was the resident or like who was like shadowing, like cleaning my teeth and stuff. That's so funny.
After dental school, Alex did his residency at Wyckoff Heights Medical Center in New York. He didn't have to do a residency necessarily, but he had a good reason to.
In New York, in order to practice as a dentist in New York, in the state of New York, you have to have a 1-year residency.
Okay.
Other states, you can take licensing exams. So in Massachusetts, you
on
can
paper, or is it like a trial test or something?
Yeah, it's a trial. Yeah, okay. You do certain procedures on patients, and then there's also a written component.
Wow.
For like Connecticut, Massachusetts, and New Jersey, you don't have to have a residency. You can every state is different. In New York, you have to have a residency. I was going to do a residency regardless because it gives you see more procedures versus going right into private practice.
What was the process of getting the residency? Did you apply?
So there's a thing, I don't know if you know, there's a thing that's called match.
Okay.
You apply to a bunch of residencies, then the residencies rank you based on how much they want you, and you rank them.
Gotcha.
It's basically,
I never heard of that.
Yeah, and then you match. And on one day, everyone goes to either their email or their lockers, and you find out where you're going. It's called Match Day. It's both popular in the medical field and then in the dental field.
That's awesome. Before Bumble Biz was a thing.
Yeah, exactly. Yeah.
Cool.
So it's called Match Day. I matched at Wyckoff. I applied to a few programs, and then if you don't get in, it's called postman. The reason why they do it is so one person doesn't hold 5 or 6 spots, right? That top of the class person who's very desirable could say, yes, I'm going here, say yes to 5 places, and then say no, then 4 more times,
Yeah.
So that's the reason why it was created.
Do you remember what you ranked them?
Oh, Wyckoff was my number 1.
Oh, cool.
Yeah.
Right.
It was my number 1 because it's a very busy hospital. You get to see a lot of different procedures. They're a trauma 2 center, so you get to see a lot of trauma. I really wanted to get that. I wanted to get my hands dirty. No pun intended. Yeah,
for sure.
Great. So you decided to open your own practice, right?
Yes.
And then, when picking different career tracks in dental school, did you always want to open your own practice? And is that considered the more entrepreneurial route when picking a,
Really good question. It depends. It all depends on, so certain people who are dentists, right? Dentists are kind of geeky people, right?
That I wouldn't say you're geeky.
Well, thank you. I appreciate it. But it's
not a bad thing.
It's people that, we're kind of nerdy, we're geeky, we're very competitive in terms of academics, right? Some of us are very competitive. And you're not, you can be an associate where you come in 9 to 5, the office is already running. The patients are there, the schedule is done. You come in, you drill, you do your thing, you fill, you treat patients, and then you leave. You don't have to worry about billing, insurance. You kind of come in and then you leave. Other people want to have more control of the type of procedures you're doing or the type of environment you want to set up. So the beauty of dentistry is you can create a lifestyle that's good for you, that works for you. I'm really driven to create an experience for my patients that I couldn't do working for other dental owners.
Gotcha. Makes sense.
So I said, I'm going to create my own experience for my patients where I get to create an environment that
so the autonomy was important to you.
Exactly. Cool. Right.
Awesome.
I want to talk about actually opening the practice and starting that. What was that like? Were you nervous? How did it even form? Did you have to go take out a loan or something?
So there's two ways to start a practice. There's you can buy an ongoing practice where someone is retiring, or they have a patient list, or they may have an office with working equipment, and then you buy that practice from them, much like buying someone else's barbershop, right? Mm-hmm. Or you can open your own barbershop. You can get a chair. You can rent a chair per day and say, you know what, I'm going to go and pass my cards out and start a Wix website and do it kind of at a low cost. I decided to go the second route. I didn't want to invest. I came out with, almost $400,000 in loans. Wow. from undergrad. Okay. and from
putting a number on that.
Yeah, 464 to be exact, right? Woo! So I did not want to go into borrowing more money. Mm-hmm. So I, as working as an associate, meaning I would just come in 9 to 5, I was working at someone else's office. Yep. Part-time, I worked in my own practice. I rented a chair 1 day a week. I could not afford at the time a front desk or an assistant. I did all my own phone calls. Okay. My buddy Joe, who's also a dentist, he was in residency, was my assistant. He helped me out. I started a website. I printed some cards, and now I have a full-grown,
awesome.
That's great.
Full-time practice with a manager, a hygienist, we have our own. Yeah. We just did a massive construction. We built out a whole place on 69th. There is that entrepreneurial, you start low and then you just kind of build from there,
Awesome.
He believes word of mouth rather than other mediums of advertising yields to a more authentic type of growth that leaves appointments penciled in and smiles from ear to ear.
See, even after being born into a family of dentists, Dr. Alex took the necessary steps to make sure he also shared that passion for dentistry. We covered a lot so far in the Not Acci-Dental series. Next, join us for part 3 to recap and discuss what we learned.
Do you need experience? Are you looking for an internship? Well, you can join the team and interview anyone in any industry by becoming an Acci-Dental student interviewer. Regardless of your major or amount of experience, this is the perfect stepping stone into any internship or career. Apply to the Acci-Dental Army at experienceacci-dental.com/students. That's experienceacci-dental.com/students. Thanks for listening. To find the show notes with all relevant links and photos for this series, head over to experienceacci-dental.com. That's experienceacci-dental.com.
If you learned something in this episode, please take some time to help our mission by leaving a positive rating and review of the show. Each week, we bring you a new interview series with guests from different jobs and industries. In every series, we live a specific day in the life, hour by hour, experience the career journey, and have a discussion about what we learned. So, don't forget to subscribe.